Good morning. Welcome to the Consumers Doctors channel. Representing foremost organization. This is being recorded on a regular basis. They're talking about different healthcare related issues. Consumers Doctors' role is to educate the public on healthcare because a lot of times many people are ignorant about simple healthcare issues, and when it comes to getting the insurance and coverage, premiums, out of pocket expenses, a lot of things, folks. Today's topic is transparency. Transparency in healthcare. And what is the definition of a transparency? As is used in science, engineering, and businesses, the humanities, in other social contexts, operating it in such a way, it is easy for others to see what actions. Transparency implies openness, communication, accountability, all that. So that's what we have been talking about. There's surprise medical billing and all that. We have been talking about it, but transparency is coming into the healthcare, folks. Hospitals, doctors, labs, diagnostic facilities, rehab, you name it. We need transparency because consumer wants to know what the bill is going to be so he doesn't get surprised, and how to pay for it. That's what the transparency is needed. The goal of the price transparency is to bolster consumer style competition through shopping. That's what it is. Shopping. To lower the individual and system wide healthcare costs. That's what it is, transparency. There are several studies done, folks. Consumer driven products tend to be more competitive, and that will ultimately lower the costs of the care. So there are 10 things what they are saying the price transparency the hospitals is going to bring. What are those things price transparency brings when it's being brought to the hospitals? Number one is altering the balance of power. So consumers are being informed where and how, what is the bill is going to be like for so and so. So I think basically you're notifying the consumers. These new compliance, there are challenges, but I'm sure it can be done. There are a lot of myths on healthcare consumerism, so-called healthcare consumerism, but it is achievable. So what are the 10 short-term consequences? Number one, prices of some hospital services will be competitive, like x-rays, MRIs, CAT scans, lab services, medical and surgical procedures, spine surgeries. They are going to be competitive. So hospitals may increase the number of elective procedures like knee replacements and non-urgent coronary interventions. So that is what price transparency will become more competitive for, especially for common procedures. Number two, prices will increase their hospital services, folks. Believe it or not, it does. Many hospitals need to raise prices on emergent services, but it also increases the services for the hospitals, because once the consumer knows what the charges are, there will be more demand. Yes. And number three, some regions, especially I'm pretty sure in the urban areas, you will see higher prices overall because of the price transparency. Especially in urban areas, I'm pretty sure you will see some price increases in certain areas. And number four, the new dynamics of negotiations will accelerate consolidations. This price transparency, hospitals and health systems will leverage for a tougher payment negotiations. And number five, some rural and safety net hospitals will not be able to survive because of the price transparency. But again, with today's technology, folks, I'm not concerned about that happening because of the telemedicine, telehealth. So technology will solve that problem. I don't think rural hospitals will have a better care access through technology. So question of rural hospitals not surviving doesn't even arise, because technology will take care of it. So price transparency is good for the rural hospitals too, because even though the prices may be lower in the rural hospital, but technology will solve that problem. And number six, adoption of new technology will be slow unless there is a very strong value to it. So these are the elements we don't talk about much. The technology will be slow because of this, unless there is a very strong value to that. But I'm sure healthcare will embrace technology and will continue to go through the changes, embrace the changes, irrespective of the price transparency. I don't think that's an issue. And number seven, payers will experiment with new benefit and reimbursement models because of the price transparency. Payers will, I don't blame them, because they need, if they are transparent, they're going to experiment with some new models out there. That's a good thing for consumers. That's a good thing. That will bring transparency to the front lines. And number eight, price transparency will add a new dimension to the antitrust compliance. So proposed mergers and acquisitions, the way things are happening now, will be under review by the DOJ, Department of Justice, because it will become, if people try to consolidate, that is going to be reviewed by the DOJ. So mergers and acquisitions will slow down, no doubt about it, because If it's an anti-competition, there's DOJ will be involved. And number 9, this price transparency will not affect the majority of the consumers. It will not affect the majority of the consumers. Who are insulated from the true costs of healthcare. Many Medicare beneficiaries are not subject to deductibles and co-payments, while other plans with fixed cost sharing. Medicaid beneficiaries generally have minimal or no financial liability for services. A very small fraction of the consumers covered by the high deductible health plans in the consumers market may be influenced by this rule of transparency. These are the HDHP accounts, folks. Ultimately, it will have a minimal impact on privately insured individuals with low out-of-pocket obligations. That was number 9. And number 10, transparency could complicate efforts to advance value-based payments. What does it mean? The price transparency rules comes at the same time where CMS is exhorting and incentivizing hospitals to ramp up long-term strategies to align with value-based payment initiatives. Yet, price transparency is based on the assumption that payment is provided on a fee-for-service basis aligned with traditional volume-based revenue strategy. So ultimately, this price transparency will benefit the consumers the most. It will bring some interesting aspects to the healthcare. I would love to see more and more consumers get educated regarding these costs of the care. I see these Medicare ads being bombarded till December the 7th, but there's no transparency. They say this free, that. There is no transparency, folks. Anyway, coming back to the transparency, that's a good thing for all of us. So we are not going to be surprised with medical bills. Thank you for joining Consumers Doctor from Foremost Organization. I love you guys. I want more feedback from you. If you do like this channel, Consumers Doctors Live channel, subscribe, share, and hit that bell. We will have fun with this. I would love to see a feedback from audience, folks. I'm sure there are a lot of questions. I think this is where I will have full gratification of interacting with my audience. I'm not there yet, but I'm looking forward to hearing from you guys. We will see you on a daily basis, folks. There's no specific time, but I will be broadcasting on a regular basis on this Consumers Doctors Live. We will see you tomorrow. Adios.